In France, we've got technology, solutions, services, and expertise is a high level also. Okay. So, Alain, the first time I met Alain, I used your technology. I was very impressed. Can you describe it very quickly? You've got 10 minutes, so we will ask
just a test
question after.
Thank you. So I'm Alain, the CEO of Quantiq. Quantiq is a company that I have created with Fabien Niel, who is my great co-founder. So I want to tell just something about him. Anyway, Quantiq turns any camera, and especially any smartphone, into a medical device. So the idea is you take your smartphone, you look at your smartphone for 20 seconds, and we measure your vitals, such as the heart rate, your respiratory rate, and soon your SpO2, your blood pressure, and other vitals. So this is not magic. So if you may, I can perhaps explain why it's not magic. So I guess you know what is now an oximeter. So an oximeter, you put the oximeter on your finger, and it emits a light. So we are not an oximeter, but it's just the idea. And so the oximeter just measures the absorption of the light by the blood circulating on your finger. And when your heart beats, you have more volume of blood in your finger, so more absorption. And so the oximeter sees a spike, and so it can deduce your heart rate. We do exactly the same, but with the ambient light. So we measure the absorption of the ambient light by the blood circulating in your face. So it's just for an explanation. So it's a great technology, but for what? So obviously for home care, like prevention, like remote consultation, and also for remote patient monitoring. So this example of a remote patient monitoring is particularly important. So let me precise with examples. I guess you have about 2 billion people in the world suffering from chronic diseases. So it's the first cause of death in the world. Remote patient monitoring is a key for improving that. So it has been demonstrated that remote patient monitoring improve the rehospitalization. So it decreases rehospitalization, it improves the life expectancy, it's also improve the wellness of the patient. So what it's also called RPM is really important. However, it's limited by design. It means that for checking the patient health remotely, you need hardware, medical devices. So it means that the model is limited by design, so the model is not scalable. So that's what we change. Practically, we sell an API. So this API, an API is a piece of software that anyone, so any e-health solution provider, can integrate into their product. So it means that anyone can enrich their solution with remote vital monitoring. And it's especially important for under-medicalized countries, where when I talked about RPM, yes, but so it's difficult, but it's impossible in such countries. So it makes this possible. To success, so we need money, that's why we are raising funds, but also we need very good partners, great partners all over the world. So that's for this.
That's okay.
But we need partners. So we already have partners, and just as an example, the next year we have planned to work with 16 hospitals in France, but also in several countries in Africa. So the last point is important because, so why? First, because such a technology should work with everyone and with every skin color. So that's why we have already tested the solution with more than 1,000 people in Congo, RDC, and we continue. So this is the first reason. And the second reason is when we say that we want to help so under-medicalized countries, we need to work with them and we need to be there from the beginning. So that's what we do. Thank you.
That's very clear. I've got one question.
Okay.
Where are you located?
In Paris, France, at Paris Santé Campus.
That's a wonderful transition. Okay. Yeah, Paris Santé Campus. Professor Antoine Tenière, you are with us?
Absolutely, Frank. Hi.
Hi, Antoine. Okay, so you've got Quantiq and Alain Habra in your site. What is exactly Paris Santé Campus? It's a very new and a huge innovation in France. So can you describe Paris Santé Campus in a few words?
Absolutely. Thank you very much, Frank, for this great invitation. And I'm really happy to be sharing some of the latest advances in France involvement to push forward the digital transformation of healthcare. So Alain is part of our community, but Frank as well, Frank Bodino, who has presented H4D. And the idea of Paris Santé Campus is to create a unique center dedicated to digital health based on the concept that gathering expertise through entrepreneurs, through researchers, through caregivers, through institutions is one of the key in accelerating progress in digital health.